I saw someone for tonsillitis and it was pretty severe. And the question that came out of the patient was, do I have to have my tonsils removed? And I gave him the education about how tonsils, just like in my previous video I did on tonsillitis, how tonsils are a reaction to an infection. When you pick up an infection, a bacteria in particular, like strep, from somebody else, from the environment, and that's how you get infections, is you get it from the bacteria that somebody else had, unless you're carrying strep. But when you get the infection, the body does its job to fight the infection, and usually fights the infection by throwing or sending a whole bunch of white blood cells, your little police, the little police that float around the bloodstream, a whole bunch of white blood cells to the area of infection. And that means the tonsils that are in the throat, the lymph nodes that are in the neck, they all swell up to produce massive amounts of white blood cells. The problem that inherently happens when you have an infection is those factories, the tonsils and the lymph nodes, they become large very quickly. Some people, they get so large that it's too painful to get through a day. Some people with the tonsils, they get so large that they can't breathe. For that reason, the tonsils have to be dealt with, either by decreasing the swelling with steroid use and or cutting them out. Usually a surgeon won't cut out tonsils that are huge in the midst of an infection, because it's too hard to perform surgery on somebody that's inflamed and infected. So they'll wait till the infection's taken care of, they'll have the patient come back in, and at that point in time, a scheduled surgery will be done. So you don't have to cut the tonsils out when you have an infection. You don't, just by cutting the tonsils out doesn't mean you're not going to get the infection again. It just means if you get exposed again, you're not going to have severe pain because there's no tonsils to swell up. You'll always have lymph nodes. And I just watched the doctor's video. They talked about how cutting out tonsils will prevent infection. And I don't agree with that. It doesn't prevent the infection. Your immune system, staying away from other people who are sick, washing your hands, that prevents infection. So just cutting the tonsils out prevents the symptoms, the bad symptoms of difficulty with breathing, not being able to swallow, and or just pain. That's all cutting your tonsils out does. So the bottom line is that having surgery to remove your tonsils does not decrease the amount of times you get the infection. It just decreases how severe the pain is when you get the infection. Yeah, you talk to people who had their tonsils out and they'll say, yeah, I've been fine, I haven't had any infection since. They might be having an infection, they just haven't noticed it. So it's important to understand that concept. And then the other thing I didn't like with the doctor's video is that they said that the new surgeons nowadays can do the surgery real easy compared to the guillotine that they used to use before. They actually would take an instrument that looks like a guillotine, put the tonsil in it, and cut the tonsil out. Then they would burn or cauterize the tonsil. Now they use lasers, but they had mentioned that it's still kind of cool because you get ice cream after your surgery. And anybody that sees me, if you have recurrent tonsil infection or ear infection, you know ice cream and or any dairy product is a no-no. Usually I believe that with kids who have multiple infections, number one thing is to take away from something that's screwing up the immune system, and I think the majority of people in the United States do have a dairy allergy and maybe have a gluten allergy or gluten sensitivity. I think taking away those two things might prevent recurrent infection, in addition to, say, cleaning out the nose, nasal irrigation, taking a good amount of fluid every day, and getting some sleep and taking proper nutrition. I think those are the true keys to staying healthy and preventing infection, versus just cutting and continuing with a bad lifestyle.